Good day everyone, I am Jerica Javier from NUST BSN 3F and I am going to perform the procedure of teaching the client on how to use incentive spirometer. For the goal of this procedure, the patient accurately demonstrate the procedure for using the spirometer. For the equipments needed, check for incentive spirometer. And for the implementation, first, review chart for any health problems that would affect the patient's oxygenation status. Second, bring necessary equipment to the bedside stand or overbed table. Next, perform hand hygiene and put on PPE if indicated. Next, identify the patient. Next, close curtains around bed and close the door to the room, if possible. And explain what you are going to do and why you are going to do it to the patient. Next, assist the patient to an upright or semi-Fowler's position if possible. Remove dentures if they fit poorly. Assess the patient's level of pain. Administer pain medication as prescribed if needed. Next, demonstrate how to steady the device with one hand and hold the mouthpiece with the other hand. If the patient cannot use hands, assist the patient with the incentive spirometer. Next, instruct the patient to exhale normally and then place lips securely around the mouthpiece. Next, instruct the patient to inhale slowly and as deeply as possible through the mouthpiece without using nose. If desired, a nose clip may be used. Next, when the patient cannot inhale anymore, the patient should hold his or her breath and count to 3. Check position of gauge to determine progress and level attained. If patient begins to cough, split an abdominal chest incision. Next, instruct the patient to remove lips from the mouthpiece and exhale normally. If the patient becomes lightheaded during the process, tell him or her to stop and take a few normal breaths before resuming incentive spirometry. For the next procedure, encourage the patient to perform incentive spirometry 5 to 10 times every 1 to 2 hours if possible. Next, clean the mouthpiece with water and let it dry. Next, remove PPE if used and perform hand hygiene. And lastly, document the procedure.